I personally, as one of the two physicians on public health, believe that vaccines work and believe in vaccines, and I am vaccinated. My son and wife are vaccinated. I think we need to look at this issue, but I think we need to go more slowly. From my point of view, the issues are not so much scientific, but socioeconomic, sociopolitical. If we pass the initial bill as it was written and push a number of kids out of school, where and how do they get educated? What is the cost to society? If we grandfather kids in, starting from kindergarten on, haven't we undercut the argument that there's some urgency if we allow kids who are creating some risk to be in the system for another 12 years before they're out, and then start with kids at the beginning? So I think we really need to back off and look at this issue more completely. There's a lot of small details that we can perhaps get into, and the medical field out there will say anecdote is not science, and it is not. And one of the things that struck me with the 22 hours of testimony was the issue of if kids have to leave school, is the issue of the mental health impacts upon kids if they're pushed out of school. I realize the grandfathering issue may obviate that, lessen that issue, but I think it creates an issue in terms of risk and perception in creating several classes of citizens.
The bill that we have in front of us is a bill that my colleague Dr. Pettit and I on the leadership committee have not been included on as far as when it was going to become available on the committee to be heard. We sat through 22 hours. All of our Republican colleagues sat through 22 hours listening to the 3,000 plus citizens that you see here today, hearing their concerns and the problems with this bill. Yet less than 48 hours later, we are given a bill without even seeing it to be heard on and to be voted on in committee. The arrogance of the majority party cannot be underestimated here today, I will tell you that. This bill has so many small issues in it. It has a start date. If you're not vaccinated by September of this year, you will be thrown out of private and public school. The data is not there. We don't have the detailed data that we need to create that there is, in fact, a true public health crisis for us to go to these draconian measures here today. I'm somebody who believes in vaccines. My husband is a clinician. All our children are vaccinated. However, the way that we are going about it in this bill is just wrong. You're taking away religious freedoms, a constitutional right of an education, and instead of focusing on the areas that are under-vaccinated through education, you are forcing people out of our school systems. We are learning now at this late hour that the Democrats are struggling to get votes in line to pass this bill. They're coming up with amendment out of amendment to try to change this bill at the last hour to try to get it out of committee. This is serious. This takes time, it takes consideration, and to try to rush this bill through in a short session is unconscionable.
We had a working group established back in July to try to come up with an appropriate solution to address the growing trend of people exercising a religious exemption. Unfortunately, all of that hard work was thrown out, and we saw the bill that was presented before us on Wednesday, that again, we heard 22 hours of testimony. And I think the concern right now for Republicans is we have not had an appropriate conversation in public health where this conversation belongs. And the committee is trying to quick pitch this bill out of committee, out of the public health hands, and to leadership in the Democrat Senate and House. And our position is, I think it's important for us to come to the table and have dialogue within the committee. We have another month, an entire month, to JF bills out of committee. What's the rush?
It's also important to look at the CDC requirements for vaccines, and should all of those be included as mandatory to attend schools? There are vaccines on that list that are not communicable in school. They're hepatitis B, that's sexually transmitted or only transmitted through blood. So if you are someone who decides to not have that at the appropriate time, according to CDC, should you be prevented from going to school for that? As far as the data is concerned on the religious vaccinations, or the religious exemptions, I should say, many of the folks who have a religious exemption are vaccinated. They just might be missing one or two, but that is not captured in any of the data. So they're lumping religious exemption and under-vaccinated or non-compliant all together without knowing who's missing what vaccine. So we need much more detail. If this is a public health crisis, like we've been told, why don't they have the data? If I'm declaring a public health crisis, I would have the data to show that, and we don't have that. Right now, if I had a religious exemption and I didn't get one vaccine, I'm classified in that religious exemption, even though I might have had all of the other ones. So if this is a public health crisis, I would expect public health to have that level of detail, and we don't have that. And that is concerning when we're talking about displacing 8,000 children from the state of Connecticut educational system, some of which have IEPs, have autoimmune, and they would not get the services that they need if they're forced to go home.
So the Department of Public Health, in my conversations with them, have the data on the non-compliant children, the individuals that are not vaccinated and not exercising exemption. But we don't have those numbers, which we've asked for 4 months. They also, my understanding is, they already have the data of what vaccines are missing from individuals. So of course they don't have the names, it's all aggregated, but they have it in a format that I think we would be able to review. So that is one level. If we are going to take away a public education from individuals and take away a religious liberty, we've got to be narrowly tailored and make sure we're getting it right. And to me, what is so disconcerting in this process is we had a 22-hour public hearing that opened a lot of eyes on this committee. And the thought that we are voting on a bill less than a week after that public hearing without any discussion among the committee members who sat through that public hearing is astounding to me. And this is not the way the process should be working in this building. We saw in the Labor Committee last week of a meeting being not properly noticed, and they tried to ram it through anyway. We saw in Judiciary another bill that a report wasn't properly created, rammed through, and now we're seeing it here with the Public Health Committee trying to ram through a bill in this process. This process is broken. The public needs to be heard. There needs to be transparency. The days of ramming things through in the middle of the night isn't acceptable, and the public needs to stand up to this. We have bad budgets created under this, and we have to bring back the transparency to state government.
I am certainly for protecting the health and the safety of all of our school children, but I agree with my colleagues. What disturbed me the most during this process was that there was really no communication between the Department of Public Health and the Department of Education. So I think when we're looking to create policy, that all the appropriate people need to be at the table, and it disturbed me greatly. There are many provisions that are lacking in this bill that would be necessary for all of our school children. There's nothing in here with IEP plans and 504 plans. I'm questioning what are we going to do with these special education children. I think there's a lot more work that needs to be done on the bill, and I agree with all of my colleagues. What is the major rush when there's no compelling interest right now on the state? A little more time to look at this and to get this bill in the appropriate form is much better. So I just wanted to go on the record. We all care about the health interest, but this is not the way to proceed.